It's interesting. We've seen in the last year 5 new drugs approved for bladder cancer, which is phenomenal, especially since it had been decades prior to that. The problem is they really all do the same thing, and multiple expert panels we get asked, do you see a difference between these drugs? And we just can't yet. There may be a difference between the data or the way the studies were designed, and therefore whether trials are positive or negative, but we don't see a major difference between the drugs themselves. So while we have a wealth of options, really in a sense they're all the same option, what we're looking for are novel therapies. And there were 2 really interesting abstracts presented at this meeting looking at sort of a novel approach, one combined with checkpoint inhibitors and one that shows there might be success after checkpoint failure. So the first is Epacadostat with Pembrolizumab. So it's a combination IO strategy. Epacadostat, there was a lot of data being presented at this meeting on that agent. It's an IDO inhibitor, so it preps the immune microenvironment for better immune response with checkpoint inhibitor. This particular trial was interesting in that it showed a response rate that was higher than we typically see with checkpoint inhibitors, around the 30% rate. And notably, the toxicity, usually when we combine IO, we see an increase in immune-mediated toxicity. Although the numbers are small with this phase 1b basket study, we really didn't see a surge in immune-related toxicity. No colitis, no pneumonitis, knock wood. We did see rash, but again, these weren't clinically impactful to the patient, and most patients were treated either with topical steroids or a brief course of oral steroids and allowed to continue. So I think this regimen warrants further attention, both because it's active in multiple tumor types. We saw the renal cell data yesterday, bladder data today, and other data is being presented at this meeting as well, but also because that efficacy doesn't seem to be offset by toxicity. So hopefully that will hold out in larger studies, and I know those are planned for this combination.